In this video, we will demonstrate some recommendations that industry guidelines and experts give for containing spills inside a Class 2, Type A2 Biosafety Cabinet. It is advised that your safety staff be asked whether the Biosafety Manual was used to establish a spillage protocol. The readiness of suitable spillage items is guaranteed if potentially present dangers were considered in that protocol. Although the complete details may vary, industry guidelines and biosafety experts commonly advise having items on hand such as safety apparel, absorbent material, and disinfectants. Suppose a spillage takes place. It is recommended that the task cease and that all items be sealed or concealed. Guidance includes maintaining the function of the biosafety cabinet and making one's colleagues in the facility aware. One expert suggestion includes the operator's PPE being doffed and enclosed for autoclaving, followed by hand cleansing and replacement of one's PPE. Guidelines recommend the overlay of a permeable cloth onto the spillage, the gentle flooding of the spill area, and waiting for that agent to take effect. In a spillage scenario, biosafety guidelines and experts typically make superficial disinfecting or enclosure a prerequisite for the extraction of anything from the cabinet, just as they do for normal biosafety cabinet use. Guidance includes the simultaneous extraction of potentially contaminated objects from within, while keeping them enclosed. If items on the work surface interfered with treating the spill on the work surface, repeat that step as needed. Guidelines frequently include the enclosure of the cleaning cloths themselves, as well as the work surface mat. Industry experts note that any chlorides must be washed off the places where they were applied as a disinfecting agent in order to stop them from rusting, often referencing the use of clean water or alcohol for this purpose. This is similar to the recommendations given for normal cabinet use. Guidelines also commonly recommend the taking off of safety apparel and gloves, similar to how the replacement of the latter is suggested at the end of normal use. A hand cleansing is suggested at this point, and guidelines often recommend the procedure only be restarted after 10 minutes of biosafety cabinet operation. Finally, guidelines recommend that the event be documented.